Hi, my name is Rihanna Moore and my presentation will be on asthma. Asthma is chronic airway inflammation that primarily affects the lower respiratory tract and eventually impairs the functionality of the cardiovascular system. This condition stems from environmental and genetic disparities, and it is classified as a heterogeneous disease, for it can affect individuals at all ages and in a variety of ways and levels of severity. The pathophysiology behind the clinical manifestations of asthma helps to illustrate how the disease progresses and how it has the potential to create life-threatening complications. Jackson Smith, the case study that I'll be talking about in this presentation, is suffering from an acute exacerbation of asthma and has presented with the following clinical manifestations. These include severe dyspnea, widespread wheeze, tachypnea, tachycardia, an SpO2 of 94% on room air, and hyperinflated lungs. These manifestations and how they occur will be explained in more depth during this presentation in relation to Jackson Smith. After the exposure to a stimulus, the airway becomes inflamed due to hyperresponsive inflammatory mediators, which once activated obstruct the airflow by bronchoconstriction. Bronchoconstriction is the abnormally exaggerated inflammatory response and begins with the mast cell degranulation, which releases cytokine-stimulating chemical mediators during asthmatic episode. These include T lymphocytes, interleukins, prostaglandins, histamine, and nitric oxide. These chemicals have vasoactive effects, which increase capillary permeability in the bronchioles due to vasodilation, which in turn increases the blood flow to the area and to interstitial tissue. These activated immune cells attract white blood cells and inflammatory cells to the bronchioles by chemostatic factor, resulting in smooth muscle spasm in the bronchi, leading to the thickening of the airway due to inflammation and increased permeability. This also provokes the hypersecretion of mucus by goblet cells in the epithelia, which combined generate symptoms such as dyspnea, which Jackson is exhibiting. This constriction of the airway increases resistance, making the task of breathing to become strenuous and labored, further affecting the respiratory process of gas exchange in the lungs. Dyspnea and other manifestations, such as wheezing, is an indicator that can be observed and is a somewhat obvious sign that the symptoms of asthma are becoming increasingly severe. Wheezing generally occurs simultaneously. As the air passage narrows, the mechanics of inspiration and expiration undergo change as the smooth muscle tightens and the epithelial cells become damaged. As the air moves, vibration occurs, creating an audible wheeze, which further highlights the progression of inflammation that is occurring in the air passage. This would make Jackson experience feelings of breathlessness, which she complains of, which contributes towards his inability to form complete sentences when communicating. Jackson's respiratory rate of 32 is tachypneic, which is a state of respiration that is excessively rapid. In asthma, tachypnea is a result of airflow resistance, which can develop into hypoxemia as the workload of the lungs and alveoli is increased. This resistance impairs the process of gas exchange and exhalation of air that is instead trapped, contributing towards hyperinflation that takes place distal to where the obstruction is located in the bronchioles. This means that the body is not being oxygenated effectively and carbon dioxide is not being efficiently removed from the lungs. Therefore, the acceleration of the respiratory rate is due to the body's response in trying to normalize the oxygen levels that is driven by hypoxemia. Oxygen saturation are an important parameter for managing patients' percentage of oxyhemoglobin present in the blood, especially when hypoxemia is suspected. Oxygen binds hemoglobin in order to be transported throughout the body to deliver oxygenated blood to tissue and vital organs, allowing them to function. As the air becomes trapped due to bronchoconstriction and mucus secretions, it is changing the intrathoracic pressure. This impairs the alveoli as they lose their effectiveness in delivering oxygen through ventilation and perfusion, that is also known as gas exchange. This uneven ventilation results in the reduction in oxygen levels in the blood, eventually causing hypoxemia. As oxygen is an essential life element, it is always in demand by the body in order to maintain homeostatic balance. Hypoxemia becomes an increased risk factor as oxygen saturation in the blood undergo change due to the pathogenic process of asthma. In Jackson's case, he is showing signs of hypoxemia as his oxygen saturation is at 94%, which is low, indicating that his blood is not receiving adequate oxygen. and that his overall condition is worsening. Without a sufficient supply of oxygen, cells will begin to die, damaging vital organs and tissues. As a consequence, Jackson's heart rate is severely tachycardic, which means that the heart is under stress to work harder to pump blood throughout the body. As we have identified, the lungs' primary role of gas exchange has become less effective as the pathological processes continue to develop. Therefore, because of the signs of hypoxemia, the brain senses the abnormality, triggering a response, signaling the electrical impulses of the heart to alter the arrhythmia, to beat at a faster rate, to normalize the blood oxygen saturations. Coinciding with the lack of oxygen, the cells in Jackson's body start to lack the energy to function, affecting Jackson's accessory muscles and their ability to continue to the act of breathing, resulting in Jackson's diminished breath sounds and widespread wheeze. The diminished breath sounds arise from hyperinflated lungs that are caused by the above pathological processes of air trapping. Hyperinflation weakens the recoil pressure in comparison to the chest wall because of the decreased elasticity of the lungs, so they stay inflated because there is not enough time available for the air to be exhaled through the narrow airway before the next breath is taken. This interlocks with Jackson's tachycardia, as his respirations are increased to try and compensate for the lack of oxygen being ventilated. In conclusion, Jackson's exacerbation of asthma is severe due to his clinical manifestations that has been presented and explained. Therefore, acute exacerbations of asthma are serious and potentially life-threatening, as the pathogenesis of the disease cripples the body's basic ability to supply oxygen that is essential to maintain homeostasis. These clinical manifestations indicate that Jackson is in need of urgent care in order to manage this asthma and attain normal respiratory function. Thank you for your time.